Clinical waste must be disposed of in the appropriate bags, as other staff, such as porters, may be at risk of injury from improper disposal of waste. If blood is spilled, either from a container or during an operation, the spillage should be dealt with as soon as possible. Kits containing disposable towels and hypochlorite solutions are available for dealing with blood spillages. Employers have obligations on them imposed by law. The main law is the Health and Safety at Work Act, which, although it contains a section saying employees must work safely, the main responsibility is on the employer. And in the control of substances hazardous to health regulations, to cost regulations, this is quite specific, that they have to have procedures in place to control substances which may be hazardous to health. Safety signs, safety procedures and policies are there to protect you. Please pay attention to such warning notices. Health surveillance procedures for exposure to agents that can cause asthma, review of immunization status and periodic symptom review by the use of questionnaires are systems that may be in place by the occupational health departments. These procedures are for your protection. Your occupational health department may also arrange protection for a wide range of infections in a comprehensive immunization program. The hazards we have talked about are real, but with a little thought and discipline, the risks can be managed safely. Without such discipline, the consequences could be disastrous. It is as well to remember that a number of harmful chemicals are used in medicine, including some disinfectants and drugs, particularly cytotoxic agents. Well, there are a number of potential hazards that could confront the junior doctor. I mean, there are other infections other than the ones we've already mentioned. There's radiation hazards, there's lifting and handling problems, there's allergies, and it's important always to follow the guidelines that have been laid down in your hospital for the safe working with these agents. There are also psychological pressures. Emotional distress, depression and anxiety are not unusual in junior doctors, and there are powerful pressures not to admit to them. Your occupational health department takes a view that such pressure is entirely misguided and urges you to seek confidential help before anything goes badly wrong with you or with any of your colleagues. It is worth reminding you that not every patient will show their appreciation of your efforts. Stuart Whitaker has studied violence and other stress factors in the healthcare setting.
Much of the violence directed towards doctors results from alcohol, drug abuse, mental illness, and sheer frustration. Not surprisingly, it's found in those units where these are commonly encountered, such as accident and emergency units, psychiatric and mental handicap units, and sometimes out in the community. When moving between units, it's important that doctors are aware of the emergency procedures which have been developed in each of those units to deal with violent or aggressive patients. It's often too late to learn what to do once you're involved in one of the situations. So as soon as you arrive, ask, familiarise yourself with the procedures and find out what your role is in protecting yourself and other members of staff. Finally, it might be useful for you to think through your own response to aggression. Remember, in these situations, you don't need to win anything. It's often useful to remain patient and polite, to seek to diffuse the situation and disengage yourself from any area of conflict. This is best done by seeking assistance early on. There are courses which can teach you breakaway techniques, but the best way to stay safe is to be prepared and to act early on. However, if you are involved in an aggressive incident and are having some difficulty coming to terms with it, please don't let this hamper your career. Seek assistance from your occupational health department. We're happy to talk to you in a confidential setting.
I think it's important that a newly qualified doctor, or starting at that hospital for the first time, even on their second job, that they really should go along and talk to the occupational health department. They are, after all, there to help you and to help protect you.